In 2012, there were outbreaks of pertussis, or whooping cough, in children in Washington, Wisconsin, Minnesota, Montana, and New Mexico. Pertussis is a highly contagious infectious disease characterized by severe coughing with an inspiratory whoop. The severity can range from a mild infection to severe complications and death. An unimmunized infant or child can receive an infection from any infected individual. In order to increase the immunization rate for pertussis and other preventable childhood diseases, an innovative mobile health program has begun in San Diego. Participating parents receive text message reminders when their children are due for shots. The San Diego Beacon Community Project is enrolling up to 600 parents of 1-year-olds in the experimental text messaging reminder system. The Beacon community's goal is more 2-year-olds who are fully vaccinated.
The data from San Diego really shows that immunizations are really good until about 12 months. And at that time, there's a general drop-off that can really go down to as low as 60% for up-to-date status. And so the idea is, by using texting, we will be able to increase appointment adherence as well as be able to improve that up-to-date status at children under 2 years of age, and hopefully that'll carry on into the older age groups.
The texting system was designed by Santec, an innovative San Diego company that combines mobile technology with behavioral science.
Well, the goal for us as a company is to offer a platform that can be used by the Beacon community to improve immunization rates in young kids at the age of 24 months. And the success is being evaluated in a study in which some kids will receive the text messages and some won't, and will determine what the difference is between those two groups of folks at the end of that period of time.
Parents participating in the study received gentle reminders in the form of text messages about 15 and 18-month vaccinations. Call it smarter public health with smartphones.
So after a participant enrolls in the Beacon project, their information is sent to our Santex platform, which is a texting engine, and the platform will then decide which messages are sent to that participant.
So it gets smarter and smarter over time, the more the dialogue with a particular user happens.
A 2011 Pew survey conducted in English and Spanish discovered that 83% of American adults own a cell phone. 95% of Americans in their prime childbearing years send or receive text messages. With cell phones becoming so prevalent, Dr. Patrick at Santec and his colleagues at UC San Diego are developing texting platforms to prevent disease and improve health.
A major study came out in Lancet this past year, in a multi-nation study looking at the use of text messaging for tobacco. And that was kind of the breakout study that sort of was the shot across the bow that said smoking cessation can be increased by the use of this. Our particular group at UCSD, published the first randomized controlled trial of using text messaging for obesity, and some of that work has been licensed over to Santec in the content area of obesity management. So those of us that are working in this area don't think that it's the only answer, but we think that it's one of the answers to the health problems that we have, especially when we want to consider reach. We can reach a large population of people at a relatively low cost.
Santec's texting platform works with almost all cell phone carriers. It is integrated with clinics and public health records.
I'm in school full-time, I work, I have 3 children. And I really feel like this study is going to help, my child receive the immunizations that he needs on time. So I'm actually really excited to be a part of this. Thank you.
I think vaccinations are one of the great public health successes of the last century, if you will. They've created much more benefit than the harm, and what we're seeing occasionally with folks is this concern that it creates autism and other things is actually pretty well unfounded. I always say, if you look at public health, the best solutions to any public health challenge have really always been technological. I mean, the clean air that we breathe, the clean water that we drink, there's an enormous amount of technology that rides behind that. And I started years ago programming. I programmed computers in college. I've been actually involved in a lot of computer-based activities for many, many years. And this area of mobile health, there's a lot of excitement right now, and actually in San Diego County, a tremendous amount of excitement in this, we call it M-Health, in the M-Health space. If you heard Eric DePaul at Scripps talking about this, or Paul Jacobs at Qualcomm, we have a great opportunity, I think, here in San Diego to become one of the regional leaders in this area of mobile health. This actually has the opportunity to be disruptive in terms of improvements in health, because the power in the computers that we're all carrying around in our pockets is enormous these days, and if we can just harness that for purposes of reminders and health benefits and whatnot, we can make a major difference in the long run. And this could be as powerful as vaccines.
This news update was brought to you by San Diego Biotechnology Connection, a career building and media relations service and the top source for news about the thriving San Diego biotech sector.